So we've seen a few different ways to go about paying the medical covered drugs. Obviously the HCPCS level, the NDC level code pricing, so paying NDC level based on the code level reimbursement rate, or NDC level unit pricing, which was our last example, which is paying at the NDC level based on the NDC units. So this slide here, we're going to talk a little bit about some things to consider when trying to determine which is the appropriate methodology for your organization. We'll review some of the pros and cons. So HCPCS level pricing, the pros are that the NDC is not required. So there's that additional step of requiring, where you don't have to require providers to submit an NDC on the claim or capture the NDC on the claim. It's a very simple calculation of the HCPCS units, which is always a required field on the claim, by a rate. And as we saw, this can apply to multiple pricing types. So the cons to the HCPCS level pricing is that we're not capturing any NDC utilization data. There's the potential for overpayment on lower cost generics. So when lower cost generics are being utilized, if you're paying at a median code level price, you're potentially overpaying for those products. And there's potential for payment of incorrectly coded claims. NDC level code pricing. So the pros here are that we're validating that HCPCS to NDC relationship. Payment rate is specific to the NDC administered. And in this case, you don't need that unit conversion factor as part of our calculation. However, the cons here are that there is a potential payment now on the higher cost brand products because we are paying specific to the NDC. So if your provider has selected a higher cost brand NDC and we're paying for that NDC, we're paying for a higher product when potentially there was lower cost alternatives available. So it does not encourage the use of the generic or the lowest cost products. NDC level unit pricing, very similar from a pro-cons perspective. The big difference here being that NDC unit pricing can be applied either to medical or pharmacy drug claims, and you may be able to use the conversion factor as part of your calculation for reimbursement. You have to use it, but that may also come in handy for doing some different rebate initiatives or other NDC utilization tracking. Downfall here is the same as the NDC level code pricing, but there's an additional con, in our opinion, of it requires this additional conversion factor in the price calculation, and you still have that same potential for overpayment as NDC level code pricing.